Hello everyone, my name is Ankur and welcome to RJPT Simlab simulation. In this video, we will study about the dose calculation in pharmacological experiments. At the end of this video, we will be able to calculate the amount of dose required for the experimental animals and equivalent to human doses. Now, let's start with the video. At first, let us see the introduction part. Dose calculation in pharmacological experiment. The dose calculation in pharmacological aspect, fundamental aspect of pharmacology that ensures that the safe and effective administration of medication, which means the dose calculation is required for the safe and effective administration of medication. The dosage calculation and stock solution preparation based on dosage rational formula are prerequisites to drug administration in experimental animals, which means dosage calculation and stock solution preparation. These are the two terms that are the rational formula. These are the two dosage rational formula, which are prerequisites to drug administration, which means it is necessary before the administration of drugs in experimental animals. It involves determining the appropriate amount of drug required to achieve the desired therapeutic effect while minimizing the risk of adverse effect, which means the calculation of accurate dose will lead us to achieve the desired therapeutic effect of the drug, and it will also minimize the risk of adverse effects of the drug. Then, proper dose calculation is crucial in clinical practice as incorrect dose can lead to treatment failure, toxicity, or drug resistance. This calculation of the incorrect dose or administration of the incorrect dose will lead to treatment failure, which means the drug will not show its therapeutic effect accurately, or in large doses, it will only create toxicity inside the body or can also show drug resistance by the body. Pharmacological dose calculations are based on several factors, including the patient's age, weight, body surface area, renal and hepatic functions, and the drug's pharmacokinetics and pharmacodynamics. Which this says pharmacological dose calculation. The dose calculation of the pharmacological experiments are based on several factors, which includes the first patient's age. The patient's age is very crucial factor which has to be kept in mind before calculation of the dose. If we are giving our drug to small kids or infants, then it should not be of the large dose. We should not give large doses to small children. And if our patient is elderly or is old aged, then also we have to keep in mind that the dose should not be of inappropriate. Then weight. The weight of the body is very crucial. We have to give the dose according to the weight of the body of the animal or human. Then body surface area, which means the size of the body is also mandatory for the dose calculation. Then renal and hepatic function. Renal and hepatic functions are also very much important factor because renal function, if the patient is old age and his renal function is not properly, then the excretion of the drug will not be at an steady rate, so it will create toxicity and drug will not come out of the body inaccurately. And hepatic function is the liver function. So if the liver function is also not good in of the body, then the metabolism of the drug will not be properly, and the drug will not be converted into metabolites. And the drug's pharmacokinetic and pharmacodynamic. Pharmacokinetic is, as we can say, it is the study of what body does to the drug, which means when the drug is administered, the body shows action to the drug. As we can say, it shows ADME, the absorption, distribution, metabolism, and excretion to the drug. And pharmacodynamic is the study of what the drug does to the body, which means it shows its therapeutic activity. Then, different formulas and methods are used for calculating doses, such as weight-based dosing, body surface area dosing, and fixed dosing. These are the three methods that are used for the calculation of the doses. Weight-based, as we have said, that weight is a very crucial factor for the calculation of the dose. So, weight-based dosing is a method. Then, body surface area dosing. As we can see here, body surface is also a crucial factor for the calculation of the dose. And fixed dosing. This is the third dosing formula. Additionally, understanding units of measurement, conversion factors, and routes of administration is essential for accurate dosing. So, and additionally, moreover, understanding the units of measurement, which means if when we are calculating our drug, it is measured in kilogram. No, it's not measured in kilogram. It is measured in milligrams or grams. So when we convert these units, we have to carefully understand of which unit or in which unit we are converting it. Then conversion factors. We have to verify the conversion factors when we are converting from gram to milligram or from milligram to gram. And then the routes of administration is also very much necessary because if we are administering a drug through oral route, then its bioavailability is different. And if we are introducing the drug through parenteral route or IV route, then the amount of drug is also different because through oral route most of the drug gets metabolized and it gets waste, so we have to introduce a large amount of drug, and through parenteral route we do not have to introduce a large amount of drug because we are inserting directly the drug into the systemic circulation, so a small amount of drug is very much okay for inserting through the intravenous route. So now let us move to the dose calculation part. Dose calculation is in pharmacology is guided by several key principles to ensure the safe and effective administration of drug. Yes, it is a very important that we have to make sure that our drug is safe and effective for the administration. These principles help healthcare professionals determine the correct drug dosage while minimizing risk associated with underdosing or overdosing. So we will follow the principles for the healthcare of the patient and to determine the correct drug dose. And it will also minimize the risk, as we can say toxicity, or these we have two terms over here, underdosing and overdosing. Underdosing is the amount of drug which will not show any therapeutic effect or which will not reach to its therapeutic index. The therapeutic index is the range where the drug will show its therapeutic activity. Under the therapeutic and below the therapeutic index, it will not show any therapeutic effect. And overdosing is the amount of drug which exceeds the therapeutic index, which means we have provided a large amount of drug which will only show toxicity, which will increase the dose, which will not increase the therapeutic effect. It will not increase it. It will only increase the toxicity, and this is known as overdosing. Now, let us see the individualization of drug dosing. Each patient may respond differently to a drug due to variations in age, weight, metabolism, and organ function. As we have discussed earlier, age, weight, metabolism, and organ functions are the major crucial factor for the calculation of dose. So, in every patient, these factors are different, which means every patient is of different age, weight, and their metabolism and organ function is also different. So, dose calculation should consider individual patient factors such as, so now we will see the individual patient factors that we are going to discuss for the calculation of the accurate dose. The first factor is age. Age is a very crucial factor for basically for pediatrics and geriatric patients. Pediatrics are the small children or infants. We consider them pediatrics and geriatrics. Geriatric patients are old age patients. We consider them elderly patients or old age patients. Then second factor is body weight. Body weight, which means weight-based dosing, is commonly used, especially in pediatrics. So, if our patient is a pediatric patient, so it is small in size, and also his weight is also very lower than the other patients. So we have to provide an accurate dose for the small weight patient. Or in case of geriatrics, also the weight of the body is also not as that much in comparison to a normal healthy patient. So we have to calculate the accurate dose for them. Then the third factor is body surface area. Body surface area is also varies from patient to patient. Some are very healthy and some are very thin. So the body weight also differs, and it is important for chemotherapy and some other medications. Chemotherapy is a treatment given to the cancer patients. So now let us see the observation. Human equivalent dose calculation based on body surface area. So now we will calculate the human equivalent dose, the equivalent dose which we will give to humans based on the body surface area of the animal or species. As we can see here over the table, we have these criteria, the categories. The first is the species, which means of which species we are calculating the dose for. Then it's reference body weight, which means an average body weight, the working weight range, body surface area. To convert dose in milligram or kilogram to dose in milligram or meter square, we will multiply it also. And to convert animal dose in milligram or kilogram to human equivalent dose in milligram or kilogram either. So, as we can consider it, let us see the first. As for human species, the average body weight is 60 and it ranges from 50 to 80. As we know, 60 is an average weight for a human. And the body surface area is 1.62 meters square. This is also an average body surface area. And then to convert dose in milligram or kilogram to dose in milligram per meter square, we have to calculate it. And how we will calculate it? We will divide the average body weight by body surface area, as we can see here, to milligram per meter square. So we have to divide it. We have to divide 60 by 1.62. Then we will get the value of 37. This is the dose, equivalent dose for the human of weight 60. Okay. And this section shows to convert animal dose. So this is the human equivalent dose. And we have to convert the human equivalent dose for the animal. And then we will see this section. When we perform the clinical trials, then only we perform these steps. When a manufacturing of the drug is done, then we have to test it, test the drug. And before testing, before testing on humans, we test the drugs on animals, experimental animals, and then after testing on experimental animals, we test the drugs on human patients. So human testing, the drugs testing on human patients is known as clinical trials. So now let us see for the animal. So our first animal is mouse. The average body weight of mouse is 0.02 and it ranges from 0.00, 0.011 to 0.034 and the body surface area is 0.007 meter square. Then when we convert this in milligram per meter square, we get 3. We have to divide 0.02 divided by 0.007. So the value comes 3. And then when we convert this for the animal, when we have to convert it, so we have two methods. We can divide the animal dose. This is the animal dose, mouse dose. We have to divide the animal dose by 12.3. This is the calculated value. So when we have to convert the dose from animal dose to human equivalent dose, we have to divide for the mouse. We divide it by 12.3, or if we want to multiply it, we can multiply it by 0.081. This is the calculated value and this is a standard value. So if we have to find the human equivalent dose of the rat's dose from this rat's dose, so we have to divide it by 12.3 or we have to multiply it by 0.08. From both the steps we will get the same value. Similarly, for rat, the average weight is 0.15 and it ranges from 0.08 to 0.27. The average body surface is 0.025. And then when we divide it, we get the dose 6 milligram per meter square. So if we want to convert it into human equivalent dose, we have to divide it by 6.2 or multiply it by 0.162. As for guinea pig, average body weight is 0.40 kilogram and it ranges from 0.208 to 0.700 and average body surface is 0.05. So when we convert it into milligram per meter square, we get the value 8. And for converting it to human equivalent dose, we have to divide it by 4.6 or multiply it by 0.216. And as for similarly for rabbit, average body weight is 1.6 and it ranges from 0.9 to 3 and average body surface area is 0.15 meter square. And when we convert it into milligram per meter square, we get the value 12. And for converting it into human equivalent dose, we have to divide it by 3.1 or we can multiply it by 0.324. Now let us understand this table by an example. We will calculate and interpret the value of human equivalent dose and the dose for the animal. So let us understand it with an example. The question one. It says the human equivalent dose of paracetamol is 600 milligram per kilogram. Then calculate the dose for rat. We have to calculate the dose for the rat, and we have the human equivalent dose of paracetamol 600 milligram per kilogram. For that, we have a formula. The formula says dose for animal is equal to human equivalent dose divided by animal dose factor or animal dose. So when we put the value in the formula to calculate the dose for animal, we have to calculate the dose for rat. The formula says human equivalent dose, which we have already in the question, given already in the question, 600 milligram per kilogram. So we will put the value 600 milligram per kilogram, and then we will divide it by animal dose factor. The animal dose factor, as we can see in the table, the animal dose factor for rat is 6.2. We have to, for dividing it, we have the value 6.2. So we will put the value here 6.2, and then we will calculate it. So the value comes 96.77 milligram per kilogram. So this is the dose for the rat, which comes from the human equivalent dose of paracetamol. So now let us see the second example. The second question says the diazepam dose required for a guinea pig is 50 milligram per kilogram. So calculate the human equivalent dose. So in this question, we have to calculate the human equivalent dose, and we have already given the dose for the animal. Our animal is guinea pig, and the dose is 50 milligram per kilogram. So we have a formula for this. For the calculation of human equivalent dose, we have the formula human equivalent dose is equal to dose for animal into animal dose factor or animal dose. So when we will put in the formula from the value from the formula. So dose for the animal, we have given the dose for the animal is 50 milligram. We will write 50 milligram per kilogram, and the animal dose factor, the multiplying animal dose factor. So let us see in the table. Our animal is guinea pig. So for guinea pig, the multiplying dose is 0.216. So we will put the value here 0.216, and then we will calculate it. So when we calculate it, we have got the human equivalent dose of 10.80 milligram per kilogram. So I think we have understood how to calculate the dose of our animal and how to calculate the human equivalent dose. Now let's move forward. Now let us learn how to calculate the total dose that to be administered to the animal or to the human. So let us understand it through another example. The example says calculate the dose to be administered to a rat with 0.20 kilogram, 200 grams. The 0.2 kilogram, when we convert it into grams, it is 200 grams. This is the weight of the rat. And for the dose of 20 milligram per kilogram, body weight if the concentration of the given drug solution is 10 milligram per milliliter. So in this question, we have to calculate the dose to be administered for the rat. We have given in the question, it is given the weight of the rat is 0.20 kilogram or 200 grams, and the dose to be administered is 20 milligram per kilogram, and the concentration of the solution that we have to administer to the rat is 10 milligram per milliliter. So we will calculate it through the steps. We have at first step we have to calculate the total dose for the animal. So for that we have the formula total dose in milligram is equal to dose in milligram per kilogram multiplied by animal weight in kilogram. So we have to calculate the total dose. For that we have to at first the dose in milligram per kilogram. So we have the dose for the rat. It is given in the question 20 milligram per kilogram. So we'll put the value 20 milligram per kilogram into the animal weight. So the animal weight is also given in the question is 0.20 kilogram. So in kilogram, we have to write 0.20 kilogram. Then we will calculate it, and the value is 4 milligrams. So this is the total dose for the animal. Now let's move on to the second step. Calculate the volume of solution to be administered. And for that, we have the formula: volume of solution in milliliter is equal to total dose in milligram divided by concentration of the solution. So, according to the formula, let us put the total dose as we have calculated it earlier in the step 1. The total dose for the rat is 4 milligrams. And we have to divide it by concentration of the solution. The concentration is given in the question. It's 10 milligram per milliliter. So we'll put the value and then we will calculate it. So the volume of solution to be administered for the animal is 0.40 milliliter. So this is the concentration of the drug that we have to place in the 10 milligram per ml solution. So we have to administer 4 micrograms and 4 micrograms of the 4 sorry we have to administer 0.40 ml of drug into 10 microgram per milliliter solution concentration of the solution of the drug solution for the required dose. So now I think we have learned how to calculate the total dose that we have to administer to the animal, and the dose for the animal and the human equivalent dose. Now let us see the conclusion of the experiment. Dose estimation always requires careful consideration about the difference in pharmacokinetic and pharmacodynamic among species. So this statement says that dose estimation, when we estimate the dose, it requires a careful consideration about these two factors. As we have learned earlier, the pharmacokinetic factor and pharmacodynamic factors are very important factors that we have to keep in mind while calculating the dose. Then different equations described in this review could be used for dose extrapolation among species. So the different different equations used in this experiment can be used for the calculation of the dose among different species. The allometric scaling assists scientists in exchanging doses between species during research experiments and clinical trials. The allometric scaling. What is allometric scaling? Allometric scaling is a scale which describes how the characteristics of the living creature changes with its size, which means if we have a small animal, then the characteristics of that animal is different, and when it grows, and according to the time, while passing through the time, it will grow in age also and in size also. So when the increasing of the size also, the characteristic of the animal will change. So considering this factor, exchanging doses between species during research experiments and clinical trials, we have to keep it in mind that according to the size also, the doses change. Allometric scaling is generally used to convert doses among species, and it's not preferred within species. Okay. Allometric scaling, which means increasing in size with the age, changes in characteristics, is used for the conversion of doses among species, which among a singular species, which means if we are considering a species of rat, then allometric scaling is used just for single species, not preferred within the species. Okay. So now let us move on to the discussion and result part of the experiment. The discussion part says accurate dose calculation is crucial in pharmacological experiments. Factors like pharmacokinetics, pharmacodynamics, and dose response curves must be considered. Methods like allometric scaling and body surface area helps ensure optimal dosing, especially in special populations like pediatrics and geriatrics. Additionally, factors such as bioavailability, clearance, and experimental conditions must be considered to optimize dosing strategies. The discussion portion says that dose calculation is very much important in the pharmacology experiment, and various factors that we have discussed, the pharmacokinetic factor and pharmacodynamic factor and dose response curves, these factors must be considered while calculating the dose, and methods like allometric scaling and body surface area that we have discussed through an example about the body surface area, and allometric scaling about the change in characteristics with increase in the size of the animal. These factors also help us to ensure the optimal dosing for that species, and especially in special populations like pediatrics and geriatrics, which mean this statement means large scale population is of the pediatrics and geriatrics. So these factors should be considered for them very much carefully. And additionally, additional factors such as bioavailability, Bioavailability, clearance, and experimental conditions. What is bioavailability? Bioavailability is the amount of drug reached to the systemic circulation in an unchanged amount from the site of administration, which means the amount of drug that we administered to a patient when it reaches the amount reaches to the it reaches to its systemic circulation in an unchanged amount. As we know, when it passes through the first pass metabolism in the liver through in the oral route, it changes the amount of the drug. So we have to provide a large amount of drug for the oral route. But similarly, when we provide an parenteral route, the amount of the drug is not large. Or as we can say in transdermal route or topical route, the amount of the drug is not large. We have to provide a small amount of drug. Otherwise, it will increase the toxicity level. Then the clearance. Clearance is the removal of the drug from the renal, renal portion and the hepatic excretion portion. So if the clearance of the patient is different and is not good, and if it is not good, so it will affect the dosing also. Because if it will not excrete the drug, it will increase the amount of drug in the systemic circulation and it will increase the toxicity level. And then the experimental conditions. We can consider experimental conditions such as the temperature of the body or diseased condition of the body. These are the factors that we have to consider to optimize the dosing strategies. Now, let us see the result. The result says optimal dose calculation achieved with consideration of pharmacokinetic and dynamic factors, ensuring efficacy and safety in pharmacological experiments. Which means by considering these factors, we have achieved the optimal dosing of the drug by considering the factors such as pharmacokinetic and pharmacodynamic factor. And these factors ensure the efficacy and safety of the dose calculation of the pharmacological experiments and the animals that we have used. So now, in this video, I think we have learned a lot about the dosing calculation in pharmacological experiments. Let us see the introduction part also, or a general review part. By clicking this button, we can see a general review part. This portion can be studied before performing the experiment. It gives a brief introduction and details about the experiment. The principal part, the introduction part, the observation table part that we have studied, the calculation portion also, and the conclusion and the result part. Over here, we can see the download user manual. This is the user manual that our RJPT Simlab has provided for the students, those who do not have the subscription of RJPT Simlab, so they can study at least a brief introduction about the experiment. As we can see here, this is the experimental part in the written portion. So now we have come to an end of the experiment and we have completed our experiment. So now at the end part, I think we have learned a lot about our experiment, and I hope that this video was very informative for you. So thank you guys for watching this video, and for more such learning content, subscribe to our YouTube channel RJPT Informatics, and you can also follow us on our LinkedIn profiles, on Instagram, as well as in Facebook. We update and upload our such learning contents over these platforms. Thank you.